hi there. You're a little early, but please do come in. Take a seat. Good. All right, make yourself comfortable. I'll just finish these notes quickly. There we are. What can I do for you today? All right. Okay. Yes. A little bit of tenderness in the jaw area. Yeah. Okay. And just a general bit of breathing difficulties in the nose specifically. All right. Have you had any pains in your chest at all, or? No. Okay. Right. Let me just open up your records. There you are. Okay, so I'm just going to run through some symptoms with you. Have you had a stuffy nose for long? How long has it been going on? Okay. And what about a sore throat? Any temperature or fever at all? No, okay. And what about your ears? Have they been blocked at all? No. Any issues with your hearing? Okay. Have you noticed any troubles with your balance? All right. And have you had any pain in your sinuses at all? No, okay. Do you have any allergies? All right. Any sort of seasonal allergies, hay fever? And I'm just looking through your notes here on your record. I can't see any signs of any previous injuries to your head, neck or face, is that correct? You haven't had any bumps to the head recently? Okay. And have you ever had tonsillitis or had your tonsils removed at all? No, I didn't think so. I couldn't see it on there. Great, okay. Now, when was your last dental checkup? Okay, so you'll be due one shortly then. All right. And have you had any dental issues recently? All right. Okay. So what I'm going to do today is an examination of your ear, nose and throat, and we'll see if we can find out what's causing these symptoms and where they might be coming from. So I'm going to start firstly with a physical examination around your nose, your ears, your jawline and your neck. So I'll just get some gloves. Have you had any colds or viruses recently? And are you on any medication at the moment? I can't see any on your record, but are you taking anything like paracetamol or? Okay, good. Right. I'm just going to start then by feeling around your nose and around your ears, your jawline and your neck. And I'm just going to see if any of those areas feel tender to you or if I can notice anything out of the ordinary. Is that okay? Good. All right, starting with your nose. bridge of your nose. Please do tell me if any of those points are tender. No? Okay. Good. And how about your sinuses? All right. Great. And just along the bridge of your nose and down your cheeks, either side of your nose. No tenderness there. No soreness. Good. Okay, and I'm going to move now just to your ears, either side. I'll start on the right side of your head. Good. Alright. No discomfort there around the ear. And down onto your jawline here. Just there, a bit tender. Okay. And how about here? Right, okay. If you can make sure your jaw is nice and relaxed for me. Good. And now if you just bite your teeth together for me, does that make the feeling worse? Okay, we'll have a look in there in a moment. And I'm just coming down now onto your neck on the right side of your head. Okay, no tenderness in your neck at all. Okay, if you could look straight forward for me, I'm just going to feel for the lymph nodes underneath your neck here. Okay, good. So they aren't feeling swollen at all. That's a good sign. And now I'm just going to check your left ear. Same thing. Good. I'm just going to pull your ear very slightly there. That's okay, not too uncomfortable. Alright. And no tenderness, no swelling. No soreness there at all as I'm touching. Okay. And how about your jawline on this side of your face? Good. And down towards your chin? Not sore at all? Alright. And the same just down onto your neck and your throat? Lovely. Okay. Great. I'm just going to make a couple of notes about that. So, the only place you have any tenderness is just in your jaw on the right side of your face, is that correct? Yes. Okay. And I can't feel any swelling. And no signs of infection. So what we'll do is I'm just going to have a look inside your nose, your ears, and also in your mouth to see if there are any signs of what might be causing the tenderness there. Okay, so I'm going to start in your nose. If you could just tilt your head up slightly for me, and I'm just going to look in each of your nostrils there. Good. Okay. Well done. Have you had any recent headaches? Okay. And do you suffer with nosebleeds at all? Either frequently or have you had any recently? No. Good. Okay. Good. Well done. That all looks normal to me. The blood vessels look normal in your nose and there isn't any redness or any swelling up there. So I'd just like you to breathe for me through your nose if you could. So close your mouth. Good. And then take a breath in through both nostrils. Well done. Okay. And now just take a breath through one nostril. So I'm just going to close your right nostril here. Good. And breathe in through your left nostril. Well done, yes, I can hear that's a bit stuffy. And then the same on the other side, so I'm just going to close your left nostril. Well done. And breathe into your right nostril. Good, that's great. So how about your sense of smell? Have you noticed your smell has been affected at all? Alright, well I'm just going to check that very quickly. I just have a fragrance here. I'm just going to squeeze a few drops of it onto my glove. And I'd just like you to tell me if you recognise the scent. Okay, there you go. It's quite a delicate fragrance. Do you recognise that okay? Good. Yeah, that's right, it is. Great, well done. I'll just make a couple of notes there. Okay, so with the stuffiness that you've been experiencing, have you had any other symptoms go along with it? So have you had any itchy eyes at all? A little? Yeah, okay. And does your nose tend to get quite runny with it as well? Alright. And is it a seasonal thing at all? Have you noticed it gets worse at a certain time of year? Or certain times of the day? Alright. Okay. I think it might be caused by seasonal allergies, hay fever, sensitivity to pollen. You don't always have these when you're younger. Sometimes as you get a little bit older you can become sensitive to it. So I would suggest that we prescribe you some hay fever treatment and see how you go with that. You might find that it just helps to clear your nose and reduce those symptoms that you've been having. Is that okay? Good. All right. I'm just going to do the same thing, but I'm going to look inside your mouth and your throat this time, okay? So if you could open wide for me. Great. And I'm just going to look all the way to the back of your throat there. Say ah. Excellent. No sore throat recently? For any signs of redness or irritation around your tonsils, which I can't see. Good. And no signs of any tonsil stones or anything that might be causing any discomfort there. So your throat itself is looking good. So what I'd like to do now is just have a look at your teeth and around the inside of your mouth, your tongue and your cheeks. Is that okay? Alright, good. Okay, if you could open your mouth for me again. And this I'm just going to use to tap on your teeth, okay? Are you ready? Open wide for me. Good, well done. How's that? Okay. If any of them feel sore at all, just let me know. Okay. Alright, and this one? Yeah, that one a bit sore. Okay. And we'll just come around to the other side. Good. So I'll let you take a break a moment. Ready? Okay, and same again. Good. Okay. Okay, so if we come back over here, it's just this one tooth over here. And it's a bit sore there, is it? Okay. Let me just have a look inside your mouth here, in that area. Okay. Right. So the gum does look a bit sore just around that tooth actually. So you may be scrubbing a little bit too hard with the toothbrush. Have you noticed any sensitivity when you're eating hot foods or cold foods in particular? Alright. Well, I have some special mouthwash that I can prescribe that will help to treat the redness and tenderness in your gum there. But what I can't do is rule out that you might need a filling. So I would recommend that you make an appointment with your doctor, your dentist, sooner rather than later. And if you aren't registered with a dentist at the moment, we can certainly refer you to one. Is that all right? Good, okay. Okay, so all your dentist will do is just a standard examination and probably an x-ray as well, just to see what's going on in there. Okay. Lovely. Okay, I just need to check the functionality in your throat is normal. So I'm just going to pour you a little bit of water. And I'm going to feel your throat as you swallow it, just to make sure there are no issues there. So if you'd like to take this one. Good. And I'm just going to put my hands on your neck here as you swallow and go. Good. That's great. Well done. Right. The next thing I need to do then is have a look inside your ears. So I've got an otoscope here. And I'm just going to take a look and see what's going on. You haven't noticed too many troubles with your ears at all? They've not been itchy or causing you any kind of discomfort? No? Okay, right. So let's just have a quick look, starting in your right ear. I'm just going to pull here. And I'm just having a look to see what we can see inside that ear. You're doing a great job again. Is it any more sore on this side at all? Any tenderness? No. Okay. So again, you have a little bit more of a build-up in this ear, and because of that it's probably worth us cleaning both of your ears out just to make sure that it doesn't start to cause any issues for you, okay? And then I can have another good look and make sure there are no signs of infection or any issues. Alright. Great. Alright. So, I have some eardrops here, and these will work very quickly. I'm just going to put a couple of drops into each ear, and what you'll find is that you might hear a slight sort of fizzing sound as they begin to work. Alright, we'll give the ears a good clean, and then I'm going to do a hearing test to make sure that there aren't any issues going on in your ears with your hearing or anything. Okay, so if you just want to tilt your head for me slightly. Good. And 1 and 2. And then same the other way. 1 and 2. And I'm just going to massage your ears while that starts to work. Good. Okay. Let me know when that starts working. Great. Alright. Whilst that's working, I'm just going to make a couple of notes. Right. So, I'm just noting that we are prescribing some hay fever tablets and also just some special mouthwash for your gums there. Okay, ears look good. Great. Alright, so I'm just going to wipe up around here and around the bottom of your ear here. Great. And now I just have this tool, and it's not sharp at all, you can see. And all I'm going to do is use this to just remove the rest of the build-up from each of your ears. Okay, it won't be too uncomfortable. The drops have already done the bulk of the work. So, good, okay. Great. If you need me to stop at all, just let me know. and I'm just going to get right around here. And I'm just cleaning out the rest of what was left behind in your ear. Lovely job. Almost there, you're doing brilliantly. Great. Well done, and now the same on the other side. Okay. Good. Lovely job. I hope that's not too uncomfortable for you. Okay, and again I'm just going to get right around into the ear canal there. Lovely job, well done. Okay, that's all done. I'm just going to clean around the folds of your outer ear. So I'm going to do this with a cotton bud. We don't put this into the ear canal because it can push the wax down further into the ear and cause an obstruction. But we can use this to clean around the outer ear. So I just have a very gentle spray. And I'm just going to come around there and clean around those outer folds. Good. And just into each of those folds, make sure that they're all nice and clear around by your ear lobe. Good, okay. All right, you're doing great. Lovely. It's looking great in there. Alright, well done. So I'm just going to have a quick look again in each ear to make sure that they're nice and clean. This side first. Lovely. It's perfectly clear in there. You've done a brilliant job. And same on the other side. Let's have a look there. Brilliant. That looks really good. There's no build-up left over, it's nice and hearing tested to make sure that there aren't any issues with your hearing. And to do this, I'm just going to use a tuning fork initially. And I just want you to let me know if you can hear this okay, or if it's too quiet. Alright? Just around your right ear. Good. And tell me when it stops. Great, well done. And same by the other ear. And tell me when it stops again. Good. And I'm just going to go around by the back of your head, and I'd like you to tell me which ear you can hear it by. Alright. Okay, so just at the back of your head. Your left ear. Great. Good, just by your right ear, well done. And between the two, can you notice a difference in the volume? Great, well done. Alright, now I'm just going to whisper some words into each of your ears, and I would just like you to tell me what words I'm saying. Okay, ready? Stipple, 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 stipple. Stipple, 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 stipple. Spectacle, 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 I can't see any issues with your hearing at all. So, what I've done is I've just written up a prescription for some treatment for your gums and also some of the allergy tablets which should help you when you feel that your nose is blocked and congested. I've also noted that I've recommended an appointment with your dentist, a routine checkup and an x-ray, just to see if we can rule out whether a filling might be needed, but I suspect that's why you're having some sensitivity in that area of your jaw. Alright, so good luck with those and with the examination with your dentist. If you do continue to have any symptoms, then of course do feel free to make an appointment and come back and see me and we'll investigate further. Is that alright? Good. Enjoy the rest of your day.